Good afternoon, ladies and gentlemen. Warm greetings on occasion of World Food Safety Day 2021. I am Subhaprada Nishtala, and on behalf of ITC FSAN, AOAC, and the entire NetPro fan community, it is my privilege to welcome you to today's session. This year's theme, Safe Food Today for a Healthy Tomorrow, stresses that production and consumption of safe food has huge immediate and long-term benefits. By your participation today, each of you has shown their commitment to the mantra that food safety is a shared responsibility. We are joined today by Dr. Srinivas Joshi, President AOAC India, who is on behalf of AOAC and NetPro being instrumental in the event coming to culmination, and other office bearers from AOAC and other NetPro chapters across the country. On all our behalves, I'm delighted to welcome our esteemed speakers for the day, Dr. Chandrakant Panda, Padma Shri, and affectionately called India's Iodine Man. Dr. Eric Connings, past President AOAC India and Program Manager at Research Center, Switzerland. Ms. Inoshi Sharma, IRS, Director Social and Behavioral Change, FSSAI Headquarters. And Ms. Preeti Chaudhary, IRS, Regional Director for the Western Region at FSSAI. Once again, a very warm welcome to all of you, and for the context setting for the day, I request Ms. Preeti Chaudhary ma'am to please take over the session. Ma'am.
Good afternoon. Thank you, Shubha. Am I audible?
Yes, ma'am.
Thank you very much, Shubha. Good afternoon, our esteemed guest for today. First of all, greetings to everyone for this auspicious occasion of the World Food Safety Day. The theme, as we know, is the safe food now for a healthy tomorrow, which is very true actually. FSSAI is one of the pioneer authority in India working for the food safety. It is also responsible for the public health at large by ensuring the safe food regulations and by supervising it. As we know, food safety has a critical role in ensuring that food stays safe at every stage of food chain, from its production to the harvest, from processing to storage, distribution, and all the way from preparation to its consumption. So this is one of the motto of the FSSAI in India. To the brief introduction with respect to the authority, I would like to introduce, because some of the guests would not be knowing about it. In India, food safety is regulated by the Food Safety and Standard Act 2006, under which in 2011, FSSAI was established, which is Food Safety and Standard Authority of India. Through its regulation, it's managing the food safety. The other way to manage is the enforcement job. By food surveillance and other field visitation, we are ensuring and trying to keep the food that is safe for the people. And the first and foremost way before us is the outreach. As you already, Shubha has already told everyone about it, that Inoshi Sharma madam is looking after social behavior and changes with respect to the food, and which is the one of the most and the foremost way by which we are ensuring the food safety by the outreach. So the Eat Right India movement we have, Eat Right City we have, and we are also certifying the Eat Right campuses. So by this facilitative mode and hand-holding way, we are trying that we in the country, in a shared responsibility, in a shared manner, can ensure safe food for everyone. So as the theme itself said, that the safe food now for a healthy tomorrow, which is very true, and for which we all have come across, we all have joined together for this one of the day, which is very auspicious, although it has to go on and on. So everyone would be sharing their view, which is very welcoming. So on this occasion, I welcome our esteemed guests, and I also welcome to the participants here and audience who are amongst us, that they can benefit more and more with the knowledge of our esteemed guests who are here. And with this, I will over this to Shubha, and Shubha will convene. Thank you very much, Shubha.
Thank you so much, ma'am, for that brief background and very, very crisp context setting. It's now my delight to welcome Inoshi ma'am to deliver her inaugural address. Ms. Inoshi Sharma is an IRS officer, a very familiar name. I don't think any of us in the NetPro community need me to introduce her to today. She's the Director for Social and Behavioral Change and the lady who's taken charge of ensuring that India eats right from the perspective of safety, nutritional sufficiency, and sustainability. We're delighted, ma'am, that you could join us today and look forward to your inaugural address.
Thank you so much, and a very warm afternoon, a good afternoon to all of you. Dr. C.S. Panda, Dr. Erin Connings, Dr. Srinivas Joshi, my colleague Preeti Chaudhary, representatives from the industry, NetProfan members, as well as students who have joined us from all over. I welcome all of you. As has been mentioned by Preeti before, it is FSSAI which is, the highest authority in the country, which is mandated to ensure food safety. Now, regulation is something which is bound by the Act. There are regulations in place. There are people in the government, in the system to ensure quality checks, to do regular inspections, to make sure that food safety is maintained at all levels. But is that really, really sufficient? If that was so, we would not be facing the kind of crisis that we have of unsafe food in the country. Unsafe food not only poses threat to the health of the public, but also affects the socio-economic development of the country. At present, we've got about 100 million cases of foodborne illnesses, which cost us almost $15 billion annually. This silent pandemic is something that is not talked about because many times we are not aware of it, or if we are, there is very little that we think we can do about it. With the resurgence of the COVID-19 second wave, sharpened focus on safe food, nutrition, immunity, and sustainability has arisen. Today, it has become more important to focus on preventive healthcare as it minimizes the burden of diseases and helps in tracking the rising burden of diet-related diseases such as diabetes, hypertension, obesity, even malnutrition, and also unsafe food-related problems such as diarrhea, dysentery, etc., which actually pose a lot of economic stress on the common man. The food safety, therefore, is not just a mandate for the government. It's actually a shared responsibility between the producers and the consumers, along with the supervision of the government. Everyone has a key role to play. It is not just for the government to ensure that it is maintained. Now, what is it that the FSSAI has done in the recent past to ensure food safety? We are working towards the revision of the food safety standards, licensing and registration regulations, and also how to make import clearances in the country easy. Now, this would also help in the ease of business. We are trying to strengthen the food testing capabilities. We are providing rapid test kits and devices so that periodic risk-based inspections and third-party audits can be done, adulteration can be checked, and trust of the consumers in the food can be maintained. Through our programs of food safety training and certification, over 5 lakh people in the last 1 year, despite the COVID lockdowns all over the country, were trained on food safety standards and how they can ensure personal hygiene. More recently, FSSAI has also undertaken an MOU with the states where economic help or assistance and of course funds will be provided to ensure that food safety devices, personnel, internal mechanisms, infrastructure can be provided for. The Eat Right initiative of FSSAI is of course something that most of you are aware of. This was an initiative FSSAI took so that it became evident we are not just a regulator, but also a facilitator and an enabler. What it primarily means is that we don't just have to eat safe, but we also have to eat healthy and eat sustainable. That means eat local and seasonal and eat something which is good for the planet as well as for your palate. So to promote Eat Right initiatives, we have, of course, a number of benchmarking and certification programs which can be adopted by the industry, by the corporates, and easily made part of their CSR activities. We have also engaged with the cities, districts, smart cities across the country through various challenges to scale up the Eat Right movement. So a much needed collaboration between international bodies, governments, producers, consumers, the academia can ultimately improve the status quo and ensure food safety for every citizen. After all, safe and nutritious food implies a healthier population. On this special day dedicated to food safety, let us come together to share information, experiences, and solutions to ensure food safety and build a healthy future for our nation. So I hope this webinar is, all that and much more. Thank you so much.
Thank you, ma'am, as always, for inspiring us with that passion you have, that all of us do the right thing. It was wonderful to hear of the initiatives that FSSAI has put in place to build the food safety infrastructure in the country. And I'm sure the webinar will lead to global sharing of information across various parameters. Thank you, ma'am. I'm now honored to welcome Dr. Eric Connings. Dr. Connings, with a majors in analytical and clinical chemistry, started his professional career at the Food Inspection Service in Maastricht, Netherlands. He holds an MSc degree in epidemiology and a PhD in health sciences, also from Maastricht University. In 2008, he started at the European Food Safety Authority in Italy for a secondment as scientific officer at the Data Collection and Exposure Unit, and from there accepted a position in 2009 at the Nestlé Research Center in Lausanne, Switzerland. Dr. Connings is active in several standard developing organizations as past president AOAC International, with the ISO as the chair of the ISO TC34 working group on vitamins, carotenoids, and other nutrients, the European Committee for Standardization, the International Dairy Federation, and as an active participant in Codex committees on the methods of analysis and sampling, CCMAS, as a member of the interagency meeting. Dr. Eric is also a co-author of more than 40 scientific publications. We are delighted to welcome him today, and we will now be watching a pre-recorded session by Dr. Connings on identification of fit-for-purpose analytical methods for infant formula compliance testing. Following that, Dr. Eric is of course live with us to address any Q&A during the last part of our session. Sunny, can we have the presentation now, please?
Good day. My name is Eric Connings. I'm Program Manager at the Nestlé Institute of Food Safety and Analytical Sciences in Lausanne, Switzerland. Thanks to the organizers for inviting me to be with you on the 3rd World Food Safety Day. Today I'm presenting on regulatory compliance testing of food safety regulations, and in particular on the identification of fit-for-purpose analytical methods for infant formula compliance testing. The outline of my presentation will include a brief introduction, the objective of a study we did on the challenges to evaluate regulatory compliance testing for nutrients in infant formulas with current state-of-the-art analytical reference methods in collaboration with other international infant formula manufacturers as Abbott Nutrition, Danone, Fonterra, Friesland Campina, Mead Johnson, and Perrigo Nutrition. I will continue with the methods used in the study, the results of the study, and I will finalize with conclusions and recommendations. Infant formula producers must follow good manufacturing practices with strict process controls to ensure products are adequate, safe, and fully comply with regulatory requirements. Regulatory limits based on safety and nutritional considerations, as well as quality and functional properties of the product, must be taken into account. Also, regulatory requirements must be specifically met for each country in which the product is marketed. This can be quite challenging when a single product is sold in multiple countries with diverging regulations. To ensure products meet the highest standards, the global infant formula industry works to ensure a thorough understanding of the capability of an analytical method, that is, the ability of a method to produce test results within the regulatory limits, as an additional key parameter when establishing compositional criteria for nutrients and infant formulas, and performed a study on this recently by evaluating the impact of analytical method variability on the assessment of product compliance with the applicable regulations. It was estimated if current regulatory requirements can be enforced using existing performance data of AOAC, ISO, IDF methods. The scope of the study included regulatory requirements for infant formula, food for special medical purposes for infants, follow-up formula, a range of nutrients, and a number of countries as listed on this slide. 4 steps were taken to evaluate the impact of method variability on the assessment of product compliance. First, product specifications were determined based on national regulations. Secondly, the analytical method variability of published international methods by AOAC, ISO and IDF was reviewed. Thirdly, a method capability was defined. And lastly, the method capability was evaluated, and with that the ability of a method to demonstrate compliance with regulations. We acknowledge that all analytical test methods have some uncertainty. The key factor is understanding method variability in the context of the overall variability, which also includes variation in raw materials and ingredients and the manufacturing process. The overall variability must fit within the regulatory limits as illustrated in this figure. A first step in the study, product specifications ranges were calculated for each country regulation and nutrient combination based on upper and lower regulatory limits expressed as a percentage using the midpoint of regulatory requirements as the true value. The analytical method variability values from the current AOAC, ISO and IDF methods were taken, as these methods are currently considered best in class for measuring nutrients in infant formulas and adult nutritionals, with superior precision and trueness to any methods to date. To represent method variability independently from the laboratory using it, the RSDR or the reproducibility values were used as estimates. These mean reproducibility values are generated according to the IUPAC AOAC ISO International Harmonized Protocol for Collaborative Studies, including at minimum 8 laboratories and minimum 5 samples in the study. Six Sigma is an initiative for continuous improvement developed by Motorola engineer Bill Smith in the mid-80s. In this approach, Sigma, used by statisticians to denote standard deviation, can be considered as process variability, a concept representing the amount of variability relative to requirements of specifications. From this concept, the impact of analytical method variability on the assessment of product compliance can be assessed for a given analytical method by defining a method capability index CM. The method capability index compares the specifications for a given parameter to 6 times the estimated method variability. The variance of the analytical method is taken as 1/3 of the overall process variance, considering the other 2/3 coming from raw materials, ingredients, and the production process. Reworking this information results in a method capability CM less than 1.73, which will be of concern, and a method capability CM less than 1, which becomes critical because there is a risk of obtaining analytical results outside the specification range, even though the product is truly compliant with the product specifications. What the impact is of a method capability less than 1 with regard to compliance to regulations, I would like to explain using 2 examples. The first one is related to the vitamin D regulation in the European Union. You see the lower and upper regulatory limit with the red lines. You see as well the method precision of the current AOAC ISO standard indicated at just above 8%. The calculated method capability is 0.44. This means that the probability to find a test result outside the regulatory requirements is 19% for a product with a true value of 2.25 microgram per 100 kilocal in the middle of the regulatory requirements. The required method precision needed is around 2%. For the method to be able to generate results within the regulatory limits for a true value in the middle of the regulatory requirements. The second example is related to the regulatory requirements in China. You see that the regulatory requirements in China are different from the requirements in the European Union. You see as well that the method precision required is more or less the same as the precision of the current AOAC ISO standard, meaning that the standard is fit for purpose to generate results within the regulatory limits for a true value of a product in the middle of the regulatory requirements. However, GB 5008.82 2016 allows a between lab precision of 30%, which will result in a method capability of 0.48, which means that the probability to find the test result outside the regulatory requirements is 15% for a product with 3.50 microgram per 100 kilocal on vitamin D. The results of the study show that for vitamins A, B12, D and folic acid in the product categories infant formula, follow-up formula for older infants, follow-up pharma for young children, and food for special medical purposes have the highest number of country-region regulations with a method capability less than 1.73, which becomes a concern. Several country-region regulations for these nutrients show a method capability less than 1, which can be considered critical, and this includes regulations of China, the European Union, Pakistan, Russia, Singapore, South Africa, and Thailand. In addition, vitamin B1 and B6 have a method capability less than 1 for food for special medical purposes and the Russian regulation. Conclusions and recommendations. Some international methods are not fit to demonstrate compliance with the narrow nutritional regulatory limits of several countries. The method capability is less than 1. The probability of finding a test result outside the regulatory requirements due to analytical variability alone can be as high as 19%, as we have seen in the example of the vitamin D regulatory requirements in the European Union. This can cause legal uncertainties because 1 out of 5 products can be identified as non-compliant, whereas the true value is in the middle of the regulatory requirements. Of particular concern are methods for vitamins A, B12, D, folic acid, for country regional regulations in China, EU, Pakistan, Russia, Singapore, South Africa, and Thailand, as well as vitamins B1, B6 for food for special medical purposes for the Russian regulation. The situation could be improved by developing analytical methods with less variability, if at all possible, because in the example of the European Union, a method variability of 2% is required, which is almost impossible with the current technologies. It could also be considered in changing or globally harmonizing regulatory limits to fit testing capabilities. It should be considered to implement the concept of method capability when establishing regulatory limits or to help set, evaluate performance requirements which support the assessment of regulatory compliance. Finally, I would like to draw your attention, if you want to know more, to this publication in Food Control with the title Challenge to Evaluate Regulatory Compliance for Nutrients in Infant Formulas with Current State-of-the-Art Analytical Reference Methods. And at this point, I would like to acknowledge all the contributors to this scientific publication. Thanks for your attention.
I think we lost the last few seconds of that recording. However, thank you, Dr. Connings, for sharing that information with us and for explaining the impact that variability, both method and overall, has in the results and the significant impact on legal aspects and in setting of regulatory standards. I will request participants to please initiate putting your questions onto the chat box. We will request Dr. Eric to address them as far as time permits towards the end, once both the technical sessions are completed. But kindly do start putting up your questions on the chat box right away. With that, we move to our second technical session for the day, and I'm honored to welcome Dr. Chandrakant Pandav. Dr. Pandav is the former professor and head of department for the Center of Community Medicine at the All India Institute of Medical Sciences, New Delhi. He is presently a member of the National Council on India Nutrition Challenges under the Poshan Abhiyan. Dr. Pandav has been widely recognized globally in the areas of iodine deficiency disorders, IDD micronutrients, health systems research, health economics, health policy, and health program evaluation from a public-private partnership initiative. He is the co-editor of 14 books on health sciences and has authored over 600 research papers published in various national and international journals, including the SOS for a Billion and Elimination of Iodine Deficiency Disorders. Yes, it's a worthwhile investment. Dr. Pandav has received numerous national and international honors and awards that include the prestigious Dr. M.K. Seshadri Prize and Gold Medal by the ICMR in 2000 for his outstanding contribution to the field of community medicine. In 2001, he was made a Fellow of the National Academy of Medical Sciences, New Delhi, and a Fellow of the Royal Institute of Public Health, Hygiene and Society of the Public Health, London. He's been awarded the Mother Teresa Memorial Award. He has also been bestowed by the WHO Public Health Champion Award for his long and sustained contribution to public health through advocacy for and involvement in impactful health policies, strategies, and programs with proven public health achievements and substantial improvement in health outcomes. Dr. Pandav was recently conferred with the prestigious Padma Shri for his exceptional and distinguished service in the field of medicine. Welcome, sir. We are delighted that you could join us today, and we look forward to your talk on the safety aspects of fortification and the impact of policy in successful rollout of nutritional intervention approaches at a country. Over to you, Dr. Pandav.
Namaste, namaste, namaskar, namaskaram. My esteemed fellow colleagues from New Delhi, I just want to share only one story with you. We come from a culture that if you want to make a point, we tell a story. And I'm very proud of the Indian rich culture. So the story I'll tell you subsequently in due course of time. But the point that I want to take you to share with you, or the take-home message for today, is the following. I'm very proud of India's rich cultural heritage. Vasudhaiva Kutumbakam. The world is a family. That's my take-home message for all of you, esteemed delegates, ladies and gentlemen. Vasudhaiva Kutumbakam. The COVID-19 pandemic has taught us many lessons. And one of the important lessons is that COVID-19 has no respect for age, gender, place of stay, caste, color, creed, and political boundaries. So basically, I kept on remembering my ancient cultural wisdom that Vasudhaiva Kutumbakam. The title of my presentation is fairly long, and one of the important skills when you move around policy circles that you got to say things in very few words. What I call is the elevator skill. When you meet the policymakers, you barely get 2 minutes from their time, 2 minutes of their time. So the safety aspects of fortification and impact of policy in successful rollout programs of nutrition intervention approach at country level is quite a long title. What I've learned is the title should have been very simple. Linking research to policy, policy to program, and back to research, the iterative cycle. So this is an important skill we all must learn, that how to, in brief, as I call as elevator conversation, to present your point. If the policymaker is agreeable to what you have to say, then he'll give you time. But if you start telling the story, he doesn't have a time for you. So the title of my presentation, what I would do is linking research to policy, policy to program, and back to research. It's an iterative cycle. Today is the World Food Safety Day 2021. We are celebrating on Monday, the 7th of June. I just want to remind you that this is the third World Food Safety Day. Third World Food Safety Day. The first was celebrated on 2019, and the theme for 2019 as well as 2020 was the same. Food safety, everyone's business. But the theme for 2021 is following, which you all know it very well. Save food now for a healthy tomorrow. I repeat, save food now for a healthy tomorrow. It's a visionary title of the World Food Day theme. What I want to remind you is that we are part of the earth. My Hindu philosophy tells us you are made of the five elements. You are born out of these five elements, and when you leave your physical form, you go back into those five elements. And the food is the web of life. कुछ लोग जीने के लिए खाते हैं, कुछ लोग जीने के लिए खाते हैं, और कुछ लोग खाने के लिए जीते हैं. I repeat, कुछ लोग जीने के लिए खाते हैं और कुछ लोग खाने के लिए जीते हैं. When you talk of United Nations Sustainable Development Goals, actually all our efforts should be directed towards meeting the 17 UN Sustainable Development Goals. I would also bring in as a short-term title of India at 75. As you know, we got independence on 15 August 1947. So India at 75 will be 2020. So as from the Indian point of view, we should also have a landmark meetings, conferences, seminars, webinars to track the progress towards the 17 UN Sustainable Development Goals, India at 75. Now, these goals are directly or indirectly given the interconnected economic, social, political, psychological, anthropological, environmental dimensions of food systems. We must take into this consideration that the chemical food is actually agriculture is responsible for what? Shocking truth. 75% of the damage to planetary health and 75% of damage to human health is caused by chemical food and agriculture using insecticides, pesticides. That is the damage that we are causing. And as I mentioned, that the main message that I want to give it to all of you, individually and collectively, is Vasudhaiva Kutumbakam. The whole world is one family. I'll be repeating this theme again and again. What is Vasudhaiva Kutumbakam? It is an Indian philosophy emanating from a spiritual understanding that the whole of humanity is made of what? Made of one life energy. One life energy. The recent World Health Day was celebrated on Wednesday, the 7th April 2021. The theme was building a fairer and healthier world. The World Environment Day was celebrated on this Saturday, the 5th June, with the theme Ecosystem Restoration. If you correlate these two themes, we understand that it is vital to rejuvenate the philosophy. I come back to my main message, Vasudhaiva Kutumbakam. It's important for us to understand the criticality of what I call as HE and health. The linkage between health, environment, and nutrition is very critical for us to understand that. The next question that anyone would ask is, why World Food Safety Day? Why are we celebrating this day? The International Day is an opportunity to strengthen efforts. For what? To ensure that food we eat is safe. We have to mainstream food safety in public agenda. Very important point. We have to mainstream food safety in public agenda and reduce the burden of what? Foodborne diseases, not only nationally, but also globally. We cannot do today any activities in isolation. It has got global linkage. That is what we learned from COVID-19. Because I come back to my original theme and important message, Vasudhaiva Kutumbakam. The whole world is one family. What is the link to nutrition? Very simple. The first wheel of the cycle is agricultural security. Without agricultural security, you cannot have food security. And without food security, we cannot achieve nutritional security. So the linkage of the cycle between agricultural security, food security, nutrition security, back to agricultural security is very important to understand. Now, food fortification is considered as the second best strategy to address malnutrition in India. The first, of course, is eating right food in the right quantity, Eat Right India, which is an initiative started by Food Safety and Standards Authority of India, Eat Right India. However, in cases when the nutrition is not available in the staple, food fortification can be considered as the next best strategy that is possible. The triangle that smoothed the mountain is a success story of universal solidarization. I've been involved in this fight for the last 43 years continuously. 43 years I've been working on the story of iodine deficiency. Now, how did we achieve this level of success? Today, I want to share with you, all of you, as of now, 93% of India's population is consuming salt with some iodine. 93%. The population of India is 1.38 billion. When you talk of 93%, it comes to 1.25 billion people. Imagine, let's pause for a minute. Today, the Universal Salt Ionization Program has reached 1.93 billion people, 93% of the total population. When you look at the population of 193 countries, that's the equivalence to 1.25 billion. And just as a parallel coincidence, the member countries of United Nations are 193. So it's a very major, significant achievement that has taken place. The question is, how did you do that? One thing important to learn is from transnational success stories. When I look at this answer as to how did we achieve this phenomenal thing, just in last 37 years. In 1985, the coverage of iodine salt was only 5%, only 5%. And today, in 2020, it is 93%. So we made a jump from 5% to 93%. So people ask me, what is the secret? I say, it's very simple. Let's look at our neighbor, Thailand. The way they evolved their health policy is by the term called the triangle that moves the mountain. The triangle has three angles. The first angle is science, the second is society, third is the statesmanship. So it's important to understand the three important angles of the triangle that can move the mountain. Statesmanship. The decision was taken by our political leader at the highest level. Late Mrs. Indira Gandhi took a decision in 1984 to go for universal salt ionization. Next was the science. We provided on a continuous, regular basis scientific data. And society. Dr. Inoshi Sharma is a social and behavioral change communication division. Without society's participation, you cannot move forward. And for that, SBCC is very vital. It's also important to have sound science. The presentation by our esteemed guest has proved that when you have data, the data has to be not sit in the cupboards of the, not in the cupboards of the office. Data has to be linked to decision-making process. So data for decision maker is very important. At this point in time, I just want to go to about Thomas Edison, an American inventor and a business person. He says, to quote him, the doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. Look at this. In the 19th century, he made this important statement that the doctor of future will cure and prevent disease with nutrition. So that's a very central position for nutrition that we're talking about. I want to also, in the process, introduce a new dimension of health called holistic health. According to the World Health Organization, the definition of health is following. This definition was given in 1948. Health is a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, rather than focusing on specific pandemic, illness, or specific parts of the body, holistic health is an approach to life. The goal is to achieve maximum health and well-being where everything is functional at the highest optimal level possible. I repeat, the goal of holistic health is to achieve maximum health and well-being where everything is functional at the highest and optimal level possible. There are 8 dimensions of health: physical, emotional, intellectual, social, spiritual, occupational, financial, and environmental. 8 dimensions of health. Finally, I would like to conclude my presentation. Before that, I want to express my gratitude to the organizers for giving this opportunity to share my stories. I would love to tell you about the story of iodine deficiency. I can speak for 10,000 hours on this story. But I just want to end by saying what my hero in today's life, Ratan Tata, says. that eat your food as your medicines. I repeat, eat your food as your medicines. Otherwise, you have to eat medicines as your food. Dhanyawad, shukriya, shukrana. Thank you and thank you very much.
Thank you very much, sir, for that power talk and for introducing us to the triangle that moves mountains. I'm sure it's something that all of us can take away. We are today a group of largely people who work with science, and you're highlighting the systemic connection between safety and security from the agri-food and nutritional perspective is very, very well appreciated. Thank you, sir. Thank you once again for joining us today and for that extremely powerful inputs that you had on policy making. It's been a pleasure. We do have some questions, and I will start reading them out now. I also request participants, if you would like to unmute yourself and ask the question, please raise your hand and the IT team can unmute you from our end so that you can ask your question yourselves. The first question, Dr. Eric, is for you. Thank you for a very informative session. The question asks you, what is the criteria to pick up the right AOAC method for collaborative studies? The example in the study you presented, AOAC 2016-05, was adapted for analysis of D2 and D3 vitamins. But there are other AOAC methods using the same LC-MS-MS and 2016-05. Okay, there are other AOAC methods using the same LC-MS-MS ESI, and 2016-05 is LC-MS-MS APCI. So what was the criteria that one would use when making this selection?
Thank you, Dr. Joshi, for this question. I think I will give some additional information in addition to what I already gave. AOAC, a first step which AOAC does before designating an AOAC official method is determining standard method performance requirements. And some years ago, it was around 2015 or 16, AOAC established the method requirements also for vitamin D analysis in infant formula. You can find these requirements in AOAC OMA, AOAC official methods of analysis. And at that time, we tried to consider the requirements needed, including a good precision, to have a good vitamin D method to be able to assess compliance of vitamin D in infant formula with all the regulations. This has resulted in AOAC 2016-05 as the best method, and I think it is the best method to date, with a reproducibility about 8%. In infant formula, I don't think there is a better method which we can find to date. However, after 2016, the European Union, for example, changed their regulations. So the regulations for vitamin D became narrower, and this came to the situation that this AOAC official method is not appropriate anymore to assess compliance with this narrow regulatory requirement. So particularly for this vitamin D regulation in Europe, we should find a better method, if at all possible. As I demonstrated in my example, the method precision needed to demonstrate compliance with the European regulation needs to be about 2%. And this is, at least according to my and our knowledge, impossible to find such a method. So it is a problem to demonstrate compliance with this regulation if you not have an appropriate fit for purpose analytical method. So also after this 2015 15, 16, not only the European regulation change, but also this publication, as I talked about, the Method Capability Index, was published this year, and it actually can be used as a tool to identify the performance of a method you need to have a right method to be able to assess compliance with the regulation. And you can see how this method performs in relation to the regulatory requirements. So when setting requirements or when setting regulations for nutrients in a particular area, this method capability tool can be used to set the requirements. So if I look back to the requirements of vitamin D in Europe, if we would look now at the method performance requirements at AOEC, we would have to set it more tight because the European regulation has changed and the requirements would have been a method with a precision of 2%. However, we still have a problem because with the current technology, unless anybody on this call also knows a method which is able to determine vitamin D with a precision of 2%, we need to find another method. So in conclusion, important for two aspects, this method capability is it shows the precision of a method needed to be able to assess compliance with certain regulations, and it can help to set the regulatory requirements, looking at available methods, what the available technologies can do. So I hope a broad answer to your question. I hope it answers your question. Thank you.
Thank you. Thank you. Thanks a lot.
Thank you, Dr. Collins, for that very detailed response. Dr. Pandav, sir, there is one question where the participant is asking for more information on the Poshan Abhiyan and how, with the current pandemic, over-the-top supplements being taken, is there any risk of over-nutrition, and is there any safety associated with that?
Actually, at this point in time, because of pandemic, the question is the other way. There's likely to be more undernutrition than overnutrition. Because what has happened is the link has been broken. We're trying to revive that link. There are, of course, certain states are doing extremely well, as is the case in India. We have done very well. I know for sure Madhya Pradesh has done extremely well in the nutrition scenario in today's environment. What I want to understand is one important learning that we must all understand and collect is learn from the success stories of the states and see how best we can adapt to a situation which can be used in not so successful states. Now here again, I want to share with my distinguished delegates is that when you collect data, that's the first step, collection of data. Second step is analysis of the data. And normally we stop at this point of time. There is a third point, which is documentation of the data. Because what I learned in forensic medicine is records remember, people forget. And after documentation comes the most important area, that is dissemination of the data. Now, this dissemination is also very vital. You have to have a skill, an important skill of linking data to transfer it to policy makers, data for decision makers. So there are 4 steps that are involved: collection, analysis, documentation, dissemination of data is very vital. And I think we should go at the disaggregate level to collect the data. We should go at the village level. Today we have the technology. We have the technology where we can data at the village level. That's very vital in terms of taking mid-course corrective action.
Right. Thank you, Dr. Pandav, for that clarification. And I think it brings comfort to everyone that that's not overnutrition is in India as yet not something that we need to be concerned about. Dr. Eric, there is a request for any inputs that you could give on microbial safety of infant foods. I know not related to the topic for today, But if there's anything that you would like to share in terms of standards that can be referenced, of course, India has standards for these, but
yes, indeed, as you say, not related to the topic as of today, and also I'm not a microbiologist, but in terms, I know, for example, there are very active groups at, for example, ISO and ISO level, so working groups determining standards or updating standards for microbial testing. And also AOAC is active. What AOAC is doing, they are starting a new a microbial project. It's called AIMS, AIMS program. I think for those who are interested can look at the AOEC website and find more information on that. I think at first, also with the COVID situation, AOEC has done with a lot of testing methods to review testing methods for COVID. And I think the first priority for this AIMS program at AOEC will be viruses and viruses testing. So yeah, two important groups I would like to focus on, and I know ISO is also working on these aspects, and ISO is also harmonizing with the European Union in CEN on testing methods for microbiological testing. So that is what I could highly recommend for those interested in microbial testing methods at AOEC and ISO.
Thank you, Dr. Cummings. That's definitely helpful. Dr. Pandav, sir, was there something that you could add to this?
Yes, I just wanted to tell you the other part of the story. The overnutrition in the form of obesity is a very important problem in India today, especially in urban areas. So one important message that I want to give this afternoon is avoid high salt, sugar, and saturated fats. And one shocking thing that we learned in COVID-19 is that there is a direct relationship between comorbidity and death due to COVID-19. Deaths due to diabetes, hypertension, and most important, obesity. There has been a direct relationship between obesity and deaths in COVID-19 thing. So when I was telling you the story earlier, it basically was restricted to the primarily urban, rural areas. But in urban areas, there's a different picture totally. So this very important message on today World Food Safety Day is please avoid high salt, sugar, and saturated fat diet. Thank you very much.
Yes, sir. Thank you, sir, for that reminder to all of us that we stay away from HFSS. Thank you so much. With that, we are touching 4 o'clock, and I will request that we bring today's session to a close. And to do that, I invite Mr. Irmia Kattangari, who is the Assistant Director of FSSAI at ITCF SAN, to share concluding remarks and give a formal vote of thanks to all the stakeholders. Irmia, over to you, please.
Well, thank you, ma'am. Yeah, good evening, all. As all good things come to an end in life, so same is the webinar. So on behalf of International Training Center Food Safety and Applied Nutrition, so I take this opportunity to propose vote of thanks to all who have made this success to the webinar on the occasion of World Food Safety Day. So I would like to thank our keynote speakers, Eric Konings, Nestle Switzerland, ex-president AOAC, for making excellent presentations and making this webinar very interesting and technical, meaningful on the topic, identification of fit for purpose, analytical methods for infant formula complex testing. And also Dr. Chandrakant Pandav, sir, Padma Shri, member, National Council for India Nutritional Challenges, Poshan Abhiyan, for making this webinar very informative and knowledge sharing on the topic safety aspects of fortification, and impact of policy in successful rollout of nutritional intervention approaches at country level. Sir, we are really enlightened with your knowledge and your kind presence, sir. And also, I would like to thank Ms. Preeti Chaudhary, ma'am, IRS, Regional Director, West FSSI, for setting the context for this today's webinar. Thank you for your kind presence, ma'am. And also, I would like to thank Ms. Inoshi, ma'am, Inoshi Sharma, Director, Social and Behavioral Change and RCD, FSSI, for giving an inaugural address on this today's webinar. Thank you once again, ma'am, for your kind presence. I'm happy to express vote of thanks to Ms. Subhaprada Nishtala, Director in Charge, ITSFSN, and all the ITSFSN staff for making this webinar a grand success. This webinar wouldn't have been successful without your participation. So finally, I thank all the participants for your active participation. With these warm words and vote of thanks, we move to the end of today's webinar. Save food now for a healthy tomorrow. Food safety is everyone's business.
Thank you,
Thank
Udmya,
you.
and adding on my personal thanks to Dr. Joshi and AOAC India for making this session possible and connecting us with such excellent speaker. Thank you everyone once again for joining in today.
Thank you.
Stay safe,
Thank you.
stay healthy, and enjoy health.
Thank you.
Thank you.
Thank you.